Thank you. It's good to have everyone together today so that we can all gain the most accurate and the most up-to-date information possible about this coronavirus situation that is confronting everyone in the world these days. And we're especially grateful that our public health nurse, Chris Estle, has taken time out of a very busy day and, as you can imagine, a lot of responsibilities for our community to be with us this morning with one of her colleagues, another nurse. So we're going to give Chris an opportunity to address us for a little while and give us an update from her perspective as the public health nurse for our community. And that means she's really got that responsibility for all of this communication and the well-being of our whole community here. And she's been a great partner of our school as we went through a whooping cough situation, and we've talked about vaccinations and all kinds of things. And so we're really fortunate to have such a great person here in our community taking care of our health. So I'm going to ask everyone to give their complete attention here this morning and to have questions in mind that you might like to ask Chris this morning. And then we are also recording this now so that this can be shared with your parents later today, as soon as we can get that out to them. So would you please express our appreciation and welcome to Chris Estle, our public health.
Do I need this microphone? Can you guys hear me okay without it, or do I need to use it?
I think
You need it? Okay. Good morning and thank you. Like Dr. Beall said, I am Chris Estle. I am the public health administrator, and with me today I have Deb Book. She is one of our public health nurses as well. Deb and I have both been nurses for a very long period of time. We've been through lots of things together throughout our nursing career and our nursing journey at the health department, and then also prior to us working together. I've been a nurse for 25 years. Deb, how long have you been a nurse? 35. So together we have a lot of experience, and I think the thing that we need to put in perspective is, we're a very diverse community, and just so you guys know, I have lived here my whole entire life. Whoa, how exciting is that, right? You guys are much more culturally diverse and international than I am, and for that I'm actually kind of jealous, because you could tell me so many stories and so much information about your country, your home country, or where you got to visit with your families and friends. But for today, I'm just going to function as your public health administrator and as a nurse, as a mom, and as a grandma. Okay, so with those things being said, I just want to thank the community for having us come out today and just reiterate and confirm and discuss some concerns and some questions, and maybe give you some guidance and some other tips and tools to make yourself healthy, to stay healthy, and to focus on not just what's going on today, but what can impact your life going forward, and the prevention of the spread of virus and other illness. So first of all, I want to make sure that you guys, there's no such thing as a dumb question. I'm sure you guys all know that. Don't be embarrassed. If you want to ask a question, Deb and I will do our best to answer the questions. And I will tell you that we got to work this morning at 7:30, and then about 9 o'clock we had an email come through that we had a 10 o'clock webinar with the state health department. So we both left that webinar to come now. So there's another nurse at the department that's watching the webinar and getting the answers to some questions. So first I wanted to, yes?
Why is it being recorded?
I think it's being recorded for other students that maybe aren't here today, and for your parents, and however your school wants to use this information. Do you feel okay with that? Okay, that's a good question. So to start, I just want to give a little background on the coronavirus and other illnesses, okay? So there's 7 different types of coronavirus, 4 of which are very common, and 4 of which would be just like getting a cold or a fever, runny nose, cough, congestion, those types of things. Now, you guys were not on this planet in the early 2000s, but I was a nurse in the emergency department then. In the early 2000s, we had another coronavirus start to circulate, and it started in the country of China as well. It was called SARS, and it was an acute respiratory illness, and at that time it was a new coronavirus to the world, and there was a lot of concern and a lot of nervousness at that time about SARS. It's, anytime there's a new virus or new illness that starts to circulate and starts to impact human population and animal population, we get concerned because we don't know where it's gonna go and how it's gonna turn out and who's gonna get sick and who could maybe potentially have a life-ending result from that illness, okay? So I remember that. So we, at the time, it was at the old hospital and we had masks available. We took care of patients just like we take care of patients today. If you're sick, put a mask on. If you're concerned or if you're immunocompromised, put a mask on. But we didn't have the media hype in the early 2000s like we have today. So I want to stress that we need to look at factual information versus fear information or not factual information. And we're going to go by the Iowa Department of Public Health guidelines and the CDC's guidelines. Then several years later, then there became another coronavirus that we were introduced to, and it was MERS or MERS, however you would like to pronounce it. I've heard both. It was similar, but it impacted people in the Middle East. To my knowledge, we did not take care of any of those individuals that were sick at that time. And even then, just several years ago, we didn't have the media impact like we have now. We've been through Ebola, we've been through worldwide exposure to many, many different diseases. I've worked with your school, I've worked in this community a long time. We've had instances of measles, pertussis, we've had chikungunya, we've had dengue fever, we've had malaria, we've had lots, cryptosporosis. So we've had lots and lots of other diseases and illnesses that Deb and I and the other nurses at the health department follow up on that nobody even knows about. If somebody gets sick, they go to their healthcare provider, then they do a test, whether a blood test or a specimen of some sort, and they send that off to the lab for confirmation. And then we get that information from the state hygienic lab, and then we start that follow-up procedure. It sounds pretty simple, but it can get pretty complex depending on what's going on. What the microorganism is that we're dealing with. Let's see, I'm gonna ask a question. Does anybody in this room like science? Yes. Does anybody want to go into healthcare of some sort? Oh man. No, but one. We only have one person. Well, yay, two maybe. Okay, good for you. Maybe a few more. Okay. So it's very important to understand and to pay attention in your chemistry classes, your biology classes, and your anatomy and physiology classes. And viruses are very minute. They can mutate and change. And then we have a new virus. So does that make sense? So we have these 4 coronaviruses that are very common, and most of us in our lifetime have had one. Then we have these other 3 newer coronaviruses that we're currently dealing with, and especially the COVID-19, which is the new one. It didn't even have a name. So the CDC has indicated that we need to implement airborne and droplet precautions. So I was kind of watching you guys come in, and when I was talking to your superintendent, I'm talking away, and the next thing I know, my hand is where? It's on my face. I was touching my glasses and I was touching my face. How many germs do you think we have on our own person, in our face, in our own space? Lots. I don't even think I can count that high, okay? So we need to be aware. I just want to give some simple examples of some things that we can do, you guys can do either at school, at home, or at activities. So the first thing is, what do you think it is? Washing your hands. Very good. How long do you think you have to wash your hands? 20 seconds. How long is that? Happy birthday a couple times. Very good. Do you guys think that it's the soap or the friction or the temperature of the water that cleans your hands the best?
Together.
We got a full good answers. They're all great answers, but it's the friction in which you wash your hands with. Okay? So, and when we went to nursing school back a long time ago, that was one of the very first checkoffs we had to do. We actually had to learn how to wash our hands appropriately to prevent the spread of disease and illness in nursing school. Okay, we all think, oh geez, how dumb is this? I don't have to stand here and get a check off and have the instructor watch me. We did. Now, what do you guys think when you go to a public restroom and you have a dryer or paper towels? Which one would you prefer to use? Dryer. Are your hands always dry when you get done? Not always, right. What's another thing that happens? You wash your hands and then there's no paper towels. So what do you do with your hands?
Use your pants.
Use your pants or put it on your shirt. How clean do you think that is? Not very clean. Right, right. So some things you might, if there's no paper towels, shake them, try not to rub yourself or touch anything. Just kind of, flap them back and forth a little bit and let them air dry a little bit, okay? How do you open the restroom door when you leave the restroom? A paper towel, or it's nice if they have a door that pushes, right? Because you can use your backside, your elbow, your shoulder. But if it's a door that pulls, I don't even like that design. You guys think about this if you're going to become an engineer or an architect. You don't want to have to pull the door. You want to be able to push it. So you might have to grab your shirt and make a little to pull the door open. If they have paper towels, get a clean paper towel and use that to pull the door open, okay? I know this sounds so simple, but how many people do you think have touched that door? Couple hundred. Well, I hope they've cleaned it at some point in that period. But I'm going to talk for just a little bit, and then I'll take your questions. Okay. Let's see. What else? How clean? Okay, so we got hand washing. So do you think you should wash your hands before you go to the bathroom, after you go to the bathroom, or before and after you go to the bathroom?
Before and after.
Very good. After is always the right answer. But I just want to caution you too, we don't think about washing our hands before we go to the bathroom, but it depends what we've been doing, what kind of activity we've been doing prior to using the restroom, okay? I know when I worked in the emergency department, I worked night shift for a long time. You touch lots of surfaces, so I would wash my hands in the nursing station, and then I'd go use the restroom, and then I would come back and wash my hands after using the restroom. So it's something to think about. I know it sounds kind of dumb, and it's like, oh geez, but you want to keep yourself healthy. Okay, so we got hand washing. What do you guys do after you blow your noses? Trash the tissue. Then what do you do? With what? Soap and water. If you don't have soap and water, what do you have access to? Hand sanitizer. Right. What does the hand sanitizer need to have in it? Alcohol. In Iowa, we see ethanol as alcohol. So ethanol and alcohol are the same. Do you guys have any idea how much percentage of alcohol needs to be in that hand sanitizer? 60%. You're right. Good job. We call that the paper cut locator sometimes at our office, because you squirt hand sanitizer on. It's like, oh my gosh, I have a paper cut, didn't know it. So what's the most important thing after you use hand sanitizer? What do you need to do? Rub it in. You don't need a lot. You don't want you don't want your palm full, right? So you need to rub it in, make sure it's everywhere, and then what do you need to do? Do you want to touch something when your hand's still wet? Let them dry. Okay, very good. Very good. How many times a day do you guys think you touch your faces? This is your homework assignment, okay? I'm not going to give it homework, but I want you guys to think about this. I want you to be aware of how many times your hands come to your face, okay? We call that the T-zone. So you've got across your forehead and down, or it could be a reverse T-zone across the bottom and up. So you have germs, you're going to take them to your mucous membranes, your eyes, your nose, your mouth. How do you think most germs enter our body? Through the mouth, the nose, some through the eyes, through the mucous membranes. So keep your hands away from your face if you can. Okay? All right, so let's see. I'm looking around here. What do you guys think? How clean do you think your backpacks are?
Dirty, very, very dirty.
I agree, they're probably they're in a microorganism world of their own, okay? You probably don't even want to know what's on your bottom of your backpack. Where do you guys usually put your backpacks when you get home?
On the sofa.
Okay, so we got sofa, we got ground.
On a hanger.
Does anybody flop it on the kitchen table or the counter?
Yeah.
No, okay, no is a good answer. Because if you take your backpack and it's got all those cooties on it, you set it on the table or the kitchen counter, and then mom or dad or you get a snack, then what happens? Then you get all those germs off of your backpack. So where's a good place to park your backpack? On the sofa, on the floor by your sofa, wherever. Hang it up wherever mom and dad tell you to put it, for your teacher, okay? So, What else do you guys think about this coronavirus? Do you think that it's gonna end up in Fairfield?
No.
I would say, with my educated guess, I would say yes. It will eventually end up in our community, okay? Like every other illness and every other virus. Are Deb and I concerned about it? Yes. Do we lose sleep over it? No. We do not. Because why? Because it is a virus. Right now, they're doing testing, the CDC is doing testing with other countries, and they're learning about how it impacts pregnant women, how it would impact the baby. Right now, it's not impacting children of your age or children of my grandson's age, who's 3. Right now, it's like influenza. You guys hear the seasonal influenza, the respiratory virus? It's usually A and B combined, and we've had lots and lots of influenza, which impacts a lot of individuals that have comorbidities or other healthcare problems. And as we get older, as we get to celebrate more birthdays on this planet, what happens to our bodies? They get older, they get tired, things don't work as well as they used to. When I'm 50, things aren't working as good as they did when I was 25 or 15. And when I'm 85 or 95, what do my lungs probably look like? They're not expanding and they're not working very well. What do you think our cardiac, what do you think our heart muscle looks like? It's probably not working as good as it did when you guys were this age. So, influenza impacts our older population. Every year, thousands and thousands of people die from influenza, which is a respiratory illness, because they have another health issue going on. They have diabetes, they have heart disease, they have lung issues. So when we listen to the media, we have to put things in perspective and say, hey, yes, it impacts nursing homes. Yes, it impacts our older population. I am absolutely not being disrespectful to our older population because I'm like 56, you guys, so I'm getting there. So, but we have to put it in perspective, and we have to understand as we age, our body can't fight things like our body could fight when we were younger. Does that make sense? Do you think sometimes that we don't get information, we only get little bits and pieces of information, and then the little blurbs of information we get cause us to feel anxious or cause us to feel like, oh my gosh, this is terrible, the world's gonna end tomorrow. I mean, we all have bad things that happen to us, we all have different coping mechanisms, we all have different stressors in our life. Doesn't matter where you come, how you practice, what religion you believe in, those things impact all of us. So I'm gonna see if Deb let's see if Deb wants to add anything. So she can add something and then we'll take your questions and then we'll get you some more information.
Chris talked a little bit about hand washing. There are 2 other major things that we should keep in mind to try to keep from spreading any type of virus. Does anyone know what that might be besides hand washing?
Not being like big crowds or not touching a lot of stuff.
Good. And that's kind of coming along. It's called social distancing. And that's where you want to stay at least 6 feet from someone to kind of protect the zone around you and others.
You guys are sitting way too close.
Let's say that, yeah, you're closer than 6 feet. Let's say that you have a bad cough or you sneeze. How should you handle that? You can just yell it out.
Mask off.
Yes, cough and sneeze. So by doing that, you're not spreading all of that out into the air. You're containing it into your sleeve. And let's say you wake up in the morning and you're gonna go on this really fun field trip, but you don't feel very good, you have a fever. Should you think you should just kind of go anyway, or? And that's very tempting because that's another way that you can spread the virus. When you are sick and you come, and then everyone you're around, you can spread it so that it just keeps going and going and going. So we kind of say, try to confine yourself at home and keep your friends healthy. Do you have a question?
By staying home for like a month or more, or going to school.
I know what you'd want to do.
So how how close do you think we're sitting right here in this room? 6 feet, I should have brought a tape measure. 6 feet is a long way away, so 6 feet is a long way. So how close you guys are sitting right now? Thank you guys. 6 inches. So the other thing, a couple other things that we want to include with today is the state is constantly updating information for all of us. I know that the school has my phone number. I can get a call any time of the day or night. The college has my phone number. Fairfield Community School District has my phone number. So we are here as a resource, but I just want to stress that medicine and healthcare changes minute by minute based on what data we're receiving. Okay, so what I'm telling you guys today at 11:25 might be different by noon. Deb and I didn't even hear the last part of the webinar. So we'll see what Mandy says when we go back to the office. By 5 o'clock tonight, we could have something totally different. So you guys are all much more computer savvy than me. I'm so old they didn't even have computers when I was in school. So I would encourage you guys to do your own research. Go to the Iowa Department of Public Health's website. Go to Jefferson County Public Health's Facebook page. Go to the CDC's website. I know spring break is coming up for everybody except public health nurses. So I know there's been a lot of questions about international travel, restrictions. The CDC updates those travel guidelines almost daily. And I was just on the website before I came over here, and I think that they were updated on the 6th or 7th, something like that, maybe the 8th, maybe just yesterday. There's a new phone number that's been put out by the Iowa Department of Public Health. It's 211, which is a public call center to answer general questions from the public. Okay? I know that this is a challenging time. I know that there's a lot of concern. I know that you guys, coming from other countries, other parts of the world, you have different hygiene practices, you see things differently, you have different governmental restrictions and non-restrictions. I think the thing is, here in our community, I respect that, and I want to do the greater good and take care of our community as a whole. So just know that the health department is here to work with everyone, and we just, try to do the best we can with the information that we're provided. Again, those travel guidelines and things can change on a daily basis. We don't have all the answers. We didn't come here to give you all the answers because we don't have all the answers. And I think as Americans, as people, especially in this day and time, we're used to immediate information. We want it now. All you have to do is Google it. Well, that's great, but sometimes Google doesn't give you the greatest information, okay? Especially if you use Wikipedia, just saying. So, do you have something you want to say? And then we'll take a couple questions. I don't know.
Thank you very much.
I touched your hands.
Yeah, we did. We touched each other, so we're okay.
We are. We're fine.
So I think it's worth underscoring something that Chris just said, and that is your sources of information. Because we've heard some really wildly inaccurate rumors already spread, even about our community. So it's really important, I ask, that if you have any questions, you can check with us, or you can check the CDC, the Centers for Disease Control.
I put mine outside.
The Iowa Department of Public Health, and Chris, the local, you have your own Facebook page for the Jefferson County Public Health.
Mm-hmm.
So good to check that, and they'll have the most up-to-date information. And I know we've been in a number of webinars as well, and they're happening in a regular way. We're working very closely with the university community as well. We've had a lot of meetings with them to talk about all different aspects of this. So we'll be monitoring this as we go on, and we'll take steps as we need to if it's important to kind of increase our protectiveness of you. And we're even thinking, you've probably seen the news, there are over 300 million students that are not in school right now. And we don't expect that to happen here in Fairfield, but if it does, we'll be ready to try to deliver to you the best online education that we can for the time period that's necessary. So we certainly hope, we know that it's much better to be here together, and as we get information, we may take additional steps over the next few weeks and months. So we'll take a few more questions in the last few minutes. Brenda, if you can call out really loud. Yeah, so this is a question about leaving for spring break, and there's two different, is that right?
Roommates.
Yeah. So we have two types of situations here. One is air travel, and there's international air travel. It's certainly restricted to certain countries that are in level 2 or level 3. Other countries it's not restricted, so that's a second type. And then there's domestic air travel. And obviously, when you go to an airport, you're exposing yourself to unknown kind of influences. And so that is a risk that's being taken. Right now, travel is restricted to those level 2 and 3 countries. The level 1s, it's not restricted, but we may be looking at a self-imposed quarantine when someone returns from that. And that quarantine is for typically a period of 14 days. So what that would mean is you would need to stay at home. We would continue to provide online education for you, and you would need to stay out of circulation with people. So we're making arrangements to see if that would be necessary as well. Then the other kind of travel is by car. And one of that is out of state, if you wanted to go to Chicago. A second is in-state, if you wanted to go to Iowa City or Des Moines. And the third is local. And now, there aren't restrictions on that kind of travel right now for us, but there could be. And we certainly feel like as a school, we may take a conservative approach towards going on out-of-town field trips and activities. So that's something that we're discussing now. We had a meeting already this morning. And so I would expect there'll be more information that'll be coming out about those kind of precautions as well. But I think right now, what we're really emphasizing is for your individual health, that you as an individual and we as a school take responsibility. That's one of our core values. And so we respect the fact that hygiene is especially important now. We take responsibility for what we can do as an individual for ourselves, but I'm also asking as part of the solution and service to our community that we all band together and say we're going to help make sure that our school environment is as clean and safe and hygienic as it can be. So we're going to think together how we can do that. Maybe you guys could help with some of the table wipes at your desks in your classroom. We provide you with wipes. So all that responsibility isn't just our custodial staff or our teachers, but every one of us steps up and said we can be a part of the solution here. So that's what we'll be looking forward to, is keeping ourselves and our school and our community safe and healthy. And we'll think of every way that we can to make sure that we've taken all the precautions that we can. But things could change, as Chris has said.
They are, and I just want to, is this on? Yeah. I just want to make sure that you understand that. I think, again, we just need to say that again and again, that things change, and things change rapidly based on the information that we have. Do you guys know what that's called when we look to others to protect ourselves? Now, you think about the people that have cancer, maybe they're undergoing chemotherapy, or they have an autoimmune disease, and their own body is fighting itself and it can't fight off germs. We call it herd immunity. So Deb and I and everybody else is depending on everybody else to do their part to keep everybody healthy. So if you see somebody wearing a mask, it might be A, to protect themselves, or B, that person may be ill themselves and do not want to share their germs with everyone else. But Dr. Beall is correct that you guys have to help us take care of you, because all your teachers could get sick, your custodial staff could get sick. So it's everybody working together for the greater good. That's what public health does, and that's why we're here with you guys today.
So there may be some additional questions, but we're out of time right now. Chris has been very generous and Pat with their time in coming here when there's so much on their plates. But I think that if there's a need, then we could try to arrange for them to come back and spend some more time with us as things, develop and change. So we'll continue to monitor this very closely. This is our highest priority, safety first in our school. And so we welcome your other questions and comments. You can circulate those through your teachers. Make sure they get to us. We'll check with Chris, and we'll keep this information flow happening in our school. So let's again express our appreciation for Chris and Pat coming out today.